Welcome back. You're still watching Wake Up Nigeria, and right about now, joining us on health to talk about key facts to preventing avoidable blindness in Nigeria is seasoned optometrist Dr. Okpare Collins Akpobome. He is the lead optometrist at the Vision Craft Eye Clinic. Welcome to Wake Up Nigeria for the very first time. How are you doing this morning?
Thanks so much. It's a pleasure being here.
I hope I got the name correctly.
You were very close.
Hey, still very close.
You were this close. So it's actually Akpobome.
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 Now you got it.
Sorry, Mazino. Well done. Thanks. Okay, so welcome to Wake Up Nigeria. Once again, it's a pleasure to have you here. So today we're talking about key tips of avoiding, or rather, of avoiding avoidable blindness. Preventing avoidable blindness, yes. Right? But before we go into that, right, it always fascinates me when I meet doctors and then they have to specialize, right? Because when I was in law school, there was the struggle of, okay, fine, if we're asked to pick one, like I enjoy reading all of this, how do I narrow it down to one? So what was it about eyes or vision that actually got you so attracted to literally just want to study all of it?
I think somehow it's just this natural interest I have, or I've always had. But besides this natural interest, there has always been the environmental factors. And by environmental factors, I'm actually talking about people nearby, things and people I see around me, you know. And then there is this particular story that actually piqued my interest to go into eye care. And that was, there's this neighbor I had then, you know, that suddenly just woke up and went blind.
Oh, wow.
Yeah, and then at the end of the day, the usual African, there were a lot of speculations, witches and witchcraft and all of that. And then I have actually seen that happen and play out over a couple, you know, I mean, across several people actually.
Yeah.
Somehow that actually piqued my interest into going into eye care.
Oh, really? Yeah, okay, amazing. So today now we're talking about ways to prevent avoidable blindness, right? And earlier we're actually talking about how, or I was asking you why, I mean, you had a lot of northern experiences. I was asking you why that. And you actually said there you actually get to see a whole lot of these cases, right? Yeah. And I asked, okay, fine, is there a reason why? And you spoke about stuff like the weather. So now I'd like to ask, what are these ways we can prevent avoidable blindness?
Thinking about ways to prevent avoidable blindness, I think the first thing we have to do is to get this cultural shift from self-medication. Okay. So a lot of people actually do not even consider eye drops to be medications. You look like you're part of them. Okay, so a lot of people do not consider eye drops to be medications. Yeah. But these are medications. They can be toxic, they can be harmful, they can be life-threatening, they can be sight-threatening. You know, so when we have this long-standing culture of everybody is almost a doctor, you wake up in the morning, your eyes are red, instead of going to the clinic, the next thing you assume is, okay, it is conjunctivitis or it is Apollo. And then, of course, you look guilty.
No.
And then the next thing you run off to the
May I see
to the
eye
chemist.
drop as cosmetics? That's just by the way.
No, it's not. It's nowhere near. Yeah. So that over-dependence on self-medication actually is something that we have to look for a way to stop. If we're talking about, as basic as that is, if we're looking at preventing avoidable blindness, self-medication is one key thing that we have to look at stopping, all right? And then the issue of one eye drop solves it for everybody is something that we have to stop as well. Yeah. So, for example, let's say Mr. A has this red eye or this condition, probably, let's say uveitis, for example. Patient A has uveitis, he goes to the eye clinic, he gets a medication, he's placed on strong steroid therapy that actually help with that condition. It resolves. The next thing, Mr. B has red eye, that may have nothing to do with uveitis.
And right?
Just a purulent bacterial discharge, for which you really do not need that steroid. But then because it worked for Mr. A, for his red eye, it should work for me as well. So that mentality of one eye drop solves it for everybody actually is something that we have to learn to discontinue. And then secondly is this over-dependence on traditional therapy, traditional drugs, traditional medications. Yeah, there are some traditional medications that actually are NAFDAC certified. But then when we're talking about eye drops and topical solutions that you have to apply on your eyes, knowing fully well that most traditional medications have alcohol as their base, as the base compound, or as there's usually always alcohol. Now, imagine having to instill alcohol over your eyes, and you do that over a period of time. That is corneal ulcer looking at you in the eye. That is one form of visual. The whole thing just gets worse. So that over-dependence. And then there is this issue I also have to talk about that falls into this category of traditional, and that's the fact that there are a lot of persons who actually, I have noticed, this is not hearsay, there are a lot of persons who actually use urine.
Hey.
Yes.
Wow.
It will sound shocking, but there are a lot of persons who actually use urine.
In their eyes.
Yes, on their eyes. It's something that has been passed on from grandmother or great-grandmother to grandmother. So it looks disgusting, it sounds disgusting, but I have seen it countless times in practice.
So now what can be the effect of that on the eyes?
There are a lot of effects. Let me give you one clinical example. So there was a patient I saw while I was serving, while I was working in Zaria, for example, Ahmadu Bello University Teaching Hospital, Zaria. And this woman, of course, had long-standing gonorrhea, gonococcal infection. All right. Now imagine that person still wakes up and believes in using morning urine as a form of medication for her eyes. So at the end of the day, we had full-blown panophthalmitis and something else, you know, coming out from there. So these are some of the little bits that we really have to look at. And then, do we have time?
No, keep going.
Okay. Another thing we have to talk about is there is this thing I refer to as not my portion syndrome. Okay. That a lot of Nigerians actually have. This idea of it is not my portion. You know, you go to the hospital, for heaven's sake, you went to the hospital because you were feeling somehow. Now, you get there, the doctor carries out procedures, carries out tests, and then tells you, okay, madam, from all investigations, this is likely what is wrong with you, and you would have to be on medications, let's treat this. And the next thing is, I serve a living God. It is, you know, the whole, and our clergymen are actually not helping because they found a way of pitching God against medicine, whereas both of them can actually coexist mutually. Both of them. So it doesn't have to be an issue of whose reports do you believe. If for heaven's sake, you're hypertensive, just get on your amlodipine and get it down. There is no faithing it out and all of that. So, let me give you one instance, still on this whole over religiousness. So there was a colleague of mine, I don't know if you've noticed, almost every bus you enter in Lagos, there is always one person that sells, you know, there's always one person that sells a drug that cures typhoid, cures gonorrhea, staph, cures infertility. You know, there's always that one person that sells that drug. And it happened the other time, my colleague was in a vehicle, so he made a video and actually showed us someone in a bus selling an eye drop, you know, called Jesus Heal eye drop. And telling people that whatever condition, eye condition you're having, long-sightedness, short-sightedness, glaucoma, this and that, you can discontinue your medication and use Jesus Heal, you know, eye drop. And we know how very dire the consequences are for a glaucoma patient having to skip medications or having to skip doses. The consequences are actually very critical. But then when you have a society where everybody believes in, you need to see the people who are actually rushing to buy this eye drop. Not because of the combination, but because it was called Jesus Heal eye drop.
He knows that was the selling point. Okay,
that's exactly the thing.
So now, so I have this question, right? You're talking about people that even go to the hospital and then they give a report and then they reject it, right? How about getting people to even go to the hospital? Because in certain cases, especially when it comes to eye care, I don't think a lot of people pay close attention to their eyes. For instance, now, I can wake up someday and have itchy eyes. And to be honest, I won't go to the hospital because my eyes are itching me. I'll just itch it or ignore it. Do you understand? Or teary eyes and things like that. So now, what are the tips, right? Or rather, what will you say are the signs we should look out for? And like when we have those symptoms, should actually take us to the hospital, right? That, and also just round up with giving us a general eye care tip, exactly. So, like ways we can care for our eyes better.
First of all, I think let's talk about the signs and symptoms that should actually preempt you to go to the clinic. The truth is, you needn't really wait to get signs and symptoms before you make yourselves available for an eye care.
Okay.
The time has come where people should just make routine eye care more or less standard practice. You really do not have to feel itchy. You really do not have to see redness before you go to the clinic. You know, in the part of Delta where I come from, they say it is a concealed sore that eats to the bone. And you know what that means. So most of these sight-threatening conditions, the real sight-threatening conditions, are usually asymptomatic. You wouldn't feel pain. For example, glaucoma, that is the leading cause of irreversible blindness. You wouldn't feel pain. There will be no itching. There will be no nothing. Everything looks normal. So how often should
we go for healthcare?
Well, as often as you can. Every 6 months, if it's not an emergency, of course. Every 6 months you can. Yeah.
Amazing. Okay, like I would love to go on and on, but then again, at this point, we actually have to go because we don't have so much time. But then again, we're having you next week. Awesome. So definitely looking forward to that conversation.
Awesome.
Thank you so much. So right about now, Mazino, what's happening in the kitchen?